I'm right along. Good morning, everybody. I want to start by just acknowledging the amazing contribution of the community in coming forward for vaccinations. Yesterday in New South Wales, we had the biggest number of vaccinations in our state, New South Wales state vaccination hubs, than we've ever had. 61,778 people came forward to our state hubs. In addition, there were another 94,387 people who attended either at a GP or a pharmacist. So we had a total yesterday in New South Wales alone of 156,165 people received a jab. So again, thank you to all of our residents who've come forward for a vaccination. As we've said many times, vaccination is a critical path out of our current situation. Yesterday, there were also 1,035 locally acquired cases of COVID in the period up to 8 p.m. last night. There was also one overseas case. Thankfully, many people came forward for tests as well, and there were 129,182 tests undertaken yesterday up to 8 p.m. So again, thank you to all of our community in New South Wales who are coming forward whenever they have any symptoms at all, any flu-like symptoms, cold-like symptoms, or if they've been exposed to the virus, a close contact of a virus, or they've been asked to by the New South Wales Public Health team. Sadly, very sadly, we had 2 people pass away to 8 p.m. last night. One was a lady in her 70s from the Sydney Nepean Blue Mountains district, and she passed away at Nepean Hospital. There was also a lady in her 80s from Western Sydney, and she passed away at Westmead Hospital. I want to express obviously my sympathies and the sympathies of the entire New South Wales health system and our government to the families of those 2 ladies. It's a terrible situation, and to have any loved one pass away at any time is obviously challenging, but in this COVID situation, I think many of us are feeling it even more. In addition, I want to just raise some details in regard to the far western region of New South Wales. There were 4 new cases in the far west of the state to 8 p.m. last night. All 4 of those were in Wilcannia. This means that we now have a total of 69 cases in that far west local health district. I'll just remind everybody that I think the totals are now 58 in Wilcannia, 6 in Broken Hill, and 1 case has now left that area and gone to Queensland. The western New South Wales area, which is obviously somewhat closer towards Sydney, there have been 42 new cases of COVID-19 reported to 8 p.m. last night, and this brings the total cases in that western New South Wales area to 495 cases. 34 of those cases that were reported to 8 p.m. last night were in Dubbo, 6 cases were in Bourke, 1 was in Bathurst, and 1 is in Mudgee. There is some positive news in Dubbo today, which I'll just highlight too, and that is that we have the first drive-through vaccination clinic opening in Dubbo today, and that'll also be at the showground. I'm sure locals know exactly where that is. Some other issues I just want to address before I hand over to Dr. McAnulty. Obviously, the circumstances in New South Wales are such that whilst we're seeing massive vaccination numbers, we're also seeing substantial cases, and for a number of weeks now we've had no capacity for people to get married.
a decision has been taken that it's in a balanced sense. We have to be able to allow people who want to get married to get married. So as from 12:01 a.m. Friday this coming week, couples who wish to marry will be able to marry, but with minimal guests in attendance. So there'll be 5 guests allowed, in addition to those who obviously will be necessary for the actual service. So those officiating and perhaps a photographer to record the event, but we'll work through that during the course of the week. But I just want people to know that if you do wish to get married, you certainly can, as of Friday this week. Another issue which is concerning the health team is that there is a lot of misinformation being put out in social media. And one of the big concerns is women who want to have a child, couples who want to have a child. The misinformation is certainly around deterring people from effectively having a child or having a vaccination, one or the other, by suggesting that there's some negative aspects of being vaccinated in terms of your fertility. Can I just confirm that the most senior health advisory service in Australia has confirmed absolutely that there is no evidence whatsoever that a woman's fertility, for that matter a man's fertility, would be in any way affected by having the vaccine. A strong point, though, that was made to me when I was inquiring about the evidence is that particularly young women and girls who are contemplating having a child should understand that if they don't have the vaccine and they do get the virus, they may suffer from long COVID or from symptoms that would actually make it more difficult to be able to have children and to have as many children as they'd like. So I think the strong message here is don't believe what you're seeing in the social media. Don't believe what's on some of these sites that indicate that the vaccines will cause any difficulty in you getting pregnant. It certainly won't. In fact, it's precisely the opposite. I also want to address an issue around ambulances, and I'm joined here today by Commissioner Morgan from the New South Wales Ambulance, who'll have some more to say on this issue. But it's very frustrating at a time when we are getting obviously very substantial numbers of people who need New South Wales health assistance. They need to come to hospital, that there are quite a number of people who are effectively using ambulances as taxis. Ambulances are not taxis. They are meant for emergencies. I think that we all need to understand that if you call an ambulance when you really don't need an ambulance, when it's not an emergency, someone else who may really need that ambulance could well suffer, could well die. So Commissioner Morgan will have a little to say about that, and the pressures also that our ambulance service is currently under. Finally, I just want to explain to, particularly to the media, but also to the broader community, the reason why we are outside this building here today, which is the health headquarters in New South Wales, is that like every other possible venue in New South Wales at the present time, it is the case that you could expect at some time to have a positive case come into your building or the area where you are. I think Premier has said many times, just work on the basis that the people who you're coming into contact with have COVID. That's the safest way to be at the present time. This building had a cleaner enter the building on the 24th, 25th and 26th of August while she was positive, and the building is currently in the relevant parts, a very big building of course, the relevant parts subject to having a deep clean, and for that reason we are outside. I'm going to ask Dr. McAnulty to give us more information in regard to cases. I'm going to ask Susan Pearce, who is the Deputy Secretary,
to talk about our vaccination program, and then I'm going to ask Commissioner Dominic Morgan to talk about some of the challenges for our ambulance service at the present time, and particularly to ask the community to be on board with us in trying to keep ambulances for emergencies. So first of all, Dr. Jeremy McAnulty.
Thanks very much, Minister, and good morning, everyone. There were 1,035 locally acquired cases of COVID-19 reported in New South Wales to 8 o'clock last night, and one case who was acquired overseas. We're still seeing fantastic testing numbers, with 129,182 tests performed to 8 o'clock last night, compared to the previous day total of over 118,000. We have a large number of people in hospital. 778 patients with COVID are currently in hospital. 125 of those are in intensive care, and 52 require ventilation. There's quite a few young people in their 20s and 30s who are requiring intensive care therapy. And of the 125 in intensive care, 110 are not vaccinated, 14 have had 1 dose of vaccine, and 1 person has had 2 doses of vaccine. There is a health worker in Westmead Intensive Care who's been vaccinated, and it just stresses the importance that a vaccine is very effective in reducing severe disease, but it's not 100%. We all need to protect our health workers who are on the front line caring for us all in the community. To protect them, we need not only healthcare workers to be vaccinated, but all of us to be vaccinated as soon as we can. By getting vaccinated, you're reducing the chance that you'll get vaccine, but also pass it on to other people, as well as having severe outcomes like hospitalisation and even death. So please, please help protect our frontline workers. Sadly, there have been 2 deaths, as the Minister mentioned yesterday. A woman in her 70s from Sydney's Nepean Blue Mountains district who died at Nepean Hospital after acquiring infection there earlier this month. This is a 4th death linked to the outbreak of the hospital. She'd received 2 doses of COVID vaccine and also had some serious underlying diseases. A woman in her 80s from Western Sydney also has died at Westmead Hospital. She was not vaccinated, and we extend our deepest sympathy to the family and friends of these 2 people. There have now been 83 COVID-related deaths in New South Wales since the 16th of June, and 139 in total for the pandemic. We continue to be very concerned about southwestern and western Sydney cases escalating, and particularly in the suburbs of Guildford, Merrylands, Auburn, Granville, Bankstown and Grey Staines. So wherever we are in the state, of course, assume that you might be at risk of COVID, but in those areas in the southwestern and western Sydney in particular, be very aware of the COVID-safe behaviours to follow. We've also seen a number of sewerage surveillance test positive in the country areas where we haven't identified cases at this point. So we've got ongoing surveillance of sewage, which is very effective in identifying a positive, the virus that causes COVID. So we've seen that yesterday in Brewarrina, Moree, Merimbula, Barradine and Bonny Hills. So we're just urging people in those communities to come forward for testing if you have even the mildest of symptoms. It's just so important that we find cases in these areas so we can help control the spread. Thank you very much.
Thank you, Dr. McAnulty, and good morning, everyone. Quite a bit of news in the vaccination front today. As the Minister said yesterday, Friday, we gave the highest number of vaccines so far in our program across New South Wales health clinics. Can I extend my thanks to the workers out there that are working tirelessly day and night to deliver these vaccines into the arms of our community, and also the community for coming forward. As you know, we have Sports Super Sunday tomorrow. We have had a great response from the sporting clubs right across Sydney, and encouraging in particular people in the LGAs of concern to please make your booking. There are still bookings available, and get out there tomorrow in your team colours. It is an opportunity to have a little bit of fun while we continue with the very serious business of vaccinating our community. We currently have around 370,000 bookings against those priority bookings for our LGAs, and we can announce today that we're extending the age range for 16 to 49-year-old people across those LGAs to enable people 40 to 49 who have not previously had an opportunity to get a vaccination in those LGAs to be vaccinated. In addition, we have added grocery and meat workers to the link to enable people who live outside of the LGAs that work in those industries but work within them to make a booking, and that link will be available, including for 16 to 49-year-olds more broadly in the LGAs from midday today. We've added Camden as a LGA for the purposes of vaccination as part of this program as a proactive strategy to assist in vaccinating that community, as we have done with other communities that surround the LGAs over the past week. As I said, we really want people to come forward for Sports Super Sunday. This is a great opportunity. There is still bookings available right now, so please go to nsw.gov.au and make your booking. Do it now and get out there tomorrow in your team colours. We'll look forward to seeing you all. Thank you.
Thank you. Good morning, everybody. This week, New South Wales Ambulance came into contact with its 2,500th COVID patient from this lockdown alone. These are extraordinary numbers. 450 patients alone yesterday were for COVID or suspected COVID. This is bringing a very significant load on the ambulance service right across New South Wales. But before I begin, I really just wanted to acknowledge the terrific work that our paramedics are doing out there every single day. Our paramedics, our doctors, our nurses, and particularly our control centre staff who take the 000 calls under immense load. I really need to put this into perspective for you. Over the last 3 days, New South Wales Ambulance has experienced call demand to 000 equivalent of our busiest New Year's Eve. These are extraordinary times, and it places great pressure on our staff when we receive some calls that may not be medical emergencies. So I want to be really clear about this. Our 000 call operators have received calls to help take food to people's houses. 000 cannot help you with this. We have received calls for people to be driven to vaccination centres. 000 cannot help you with this. If you have a medical emergency, dial 000 and we will be there. But with the sorts of demand that we're experiencing at the moment, all of the plans that we've been putting into place for the last 18 months are now coming to fruition. It'd be really difficult for me to convey to you just what it's like to be a paramedic on the road at the moment. Our workforce is going from job to job to job without a break. They are virtually wrapped in plastic. They are doing their job without expecting anything in return. These fabulous experiences I hear from my colleagues every single day of terrific human interactions, of where they're caring for people in a most compassionate and decent way, despite the uncomfortableness and the genuine concern that they all have for the fact that they may potentially catch this virus for themselves. There's been a lot of activity across the New South Wales health system where ambulance has been engaging, particularly with the local health districts. It's a matter of record that there have been some really challenging delays at some emergency departments. I'm pleased to say that a lot of work has occurred during the last week as models of care have been changed within the hospitals to accommodate, and we've seen a significant improvement in the throughput of ambulance patients into these big hospitals. I think it's really important to make the point that, you know, these big hospitals like Westmead and Nepean and Liverpool I mean, these are aircraft carriers with really, really complex models of care. And it is not simple to simply turn them on a dime and change the way that they do things, because every decision is about patient safety. And so while we have experienced delays, I do believe that every person, whether it be our paramedics or whether it be the doctors and nurses of the health system, have actually been working in our patients' best interest to try and keep them safe. And we're seeing good outcomes for that now. Importantly, I want to make this point again. 000 is there for medical emergencies. Anytime you need a medical emergency, you have a medical emergency, New South Wales Ambulance will respond to you. But what we know is last night was the second ever status 3 alert that New South Wales Ambulance has ever had. I need to convey that level of criticality to you. Status 3 means that we are seeing impacts in our ability to respond to the community. When we receive calls that do not require an ambulance immediately, it can have dire consequences. I have been advised this week that we had a 25-minute response to an 18-year-old cardiac arrest. This is devastating. Wherever possible, we need to be avoiding this. We are surging our crews. We've brought on more than 130 new paramedics that were planned from last year. We have another 60 about to hit the road on the 11th of September. We've got another 30 hit the road as of Monday. The government invested heavily in all of the additional ambulances that I asked for last year, and now we're actually rolling them out with 104 new intensive care ambulances, which we haven't had for decades in this state. The people are there, the infrastructure is there, the willingness of our workforce is there, but we do need some help from the community. If you ever want to say thank you to a paramedic, the best thing you can do is get vaccinated. Thank you.
Minister, parents who have made bookings for
Sorry.
children who are from
Sorry, Lucy, just again.
parents who have made bookings for 12 to 15-year-old children to get vaccinated have had their bookings cancelled overnight after the Premier assured them that those bookings would be on. What's happened here?
I'll get Susan Pearce to actually give you the details, but as I understand it, I was advised last night that there had been some sort of computer glitch which had allowed people in the age bracket 12 to 15 to be able to book in circumstances that weren't actually intended at this point. As the Prime Minister announced yesterday, for the broader group of 12 to 15-year-olds, that will occur mid-September. But of course, for quite some time, there has been the capacity through the system to book 12 to 15-year-olds who were, or are, I should say, who are Aboriginal or who are currently on the NDIS, so children with disabilities, and I think children with underlying severe health issues. But I'll ask Susan, I think, suffice to say, it's not desirable, obviously, that people have been able to use the system and to effectively to be able to book in when the system is not ready for those young people yet. The system will be ready by the middle of September, as the Prime Minister said. But I'll ask Susan. I'll come back. I'll ask Susan Pearce to clarify, because she's actually directly across all those issues.
Thank you. Look, can I start by apologising for the inconvenience that this has caused to people? We absolutely understand that people want to get their kids vaccinated as soon as possible. Yesterday, unfortunately, a few things collided that resulted in some confusion. One was a social media post that went around saying that Royal Prince Alfred Hospital had 100,000 Pfizer vaccines that were about to expire. That social media post contained a link. The link allowed people to book, and it was shared very widely. In addition to that, there was a technical issue as we were upgrading our system to make provision for 12 to 15-year-olds more broadly in a few weeks' time. So we have contacted parents who have 12 to 15-year-old children presently who meet the eligibility criteria, which is on Health Direct. What happened was these bookings were able to be made outside of the eligibility checker, which is what has resulted in the issue. So again, we apologise for that. However, we have been in contact with people. We've tried to exclude people who we could see were indeed eligible. We've asked people to come forward if they believe that they're eligible, and obviously any eligible bookings will be honoured. And for others who have children in the 12 to 15-year-old age range that are generally eligible, we will be coming out in the weeks ahead to announce when we can open those bookings up more broadly so that there's a level playing field for everybody across the state at the same time. I think that's an important point to make. And again, we want to make it clear everybody who wants to get a vaccine will get one. It is just a matter of time before all 12 to 15-year-old children will be generally eligible. We'll have our systems ready to go so long as we have vaccine supply at that time, and we look forward to being able to vaccinate the children.
Someone to clarify that RPA social media post, was that in fact the case? There were...
Absolutely, categorically not.
Some of the parents who booked last night who then had cancellations have since then today got a confirmation email. A lot of them are saying they're just going to print that out and go anyway. What would you say to them?
What we would say to people is be patient. Understand that at the moment we're vaccinating a lot of people in areas of concern. There's a good reason for the prioritisation of vaccine at the moment into parts of Sydney that continue to generate 70 to 80% of the state's cases. As I said, we understand people want to get their children. We all want to get everybody vaccinated, but there are priority arrangements in place. And as I said, if children are eligible in those age ranges, we will honour those bookings. 12 to 15-year-olds otherwise will make announcements in the coming weeks as to when they're available.
How many bookings were made and have been cancelled?
I don't have that exact number, I'm sorry, but there were several thousand. Yeah.
Mr. Hazard, why is rapid antigen testing no longer considered an alternative to one vaccine dose for the authorised workers in those LGAs of concern? And why was the announcement only made public late last night?
Well, it had been under discussion for quite some time, and I think the reason that it was announced last night was because the orders were signed last night. It's as simple as that. There's been discussions with industry, between the health staff and industry, and the decision was taken that instead of having the cut-off date as the 30th of August, we would extend it to the 5th or 6th of September? The 6th, to the 6th of September. And would you like to add some more detail on that or not? No, that's fine. Yep.
Sorry, can you just explain?
Oh, and the rapid antigen testing. The rapid antigen testing can still be accommodated through the COVID safe plans, but the preferred alternative is to actually have people vaccinated, as is evidenced by the fact that, today we've got 80%, more than 80% actually, of all the cases, as was said earlier, in Western and Southwestern Sydney, and many of those are in our authorised workers. So we need people to be vaccinated and to get that first dose.
But what changed? Sorry, can I just ask what changed?
The advice from the public health team. That's what changed.
Is there a supply issue though that maybe fed into that? Was it too difficult?
Into the rapid antigen testing? The issues around that were that for some of the smaller businesses, it wasn't practical because the federal body, the federal government advisory body, requires that all rapid antigen testing be done under clinical supervision, and for some of the smaller businesses it just wasn't practical. Some of the bigger ones, yes, and they can still use those as a safety mechanism in their own businesses, but it'll be part of the COVID safety plan.
Minister, you mentioned fertility and the misinformation
Yeah.
around that. And you said social media is perpetuating a lot of that, but we've actually had reports that some health professionals, like people's GPs, are actually advising them to wait to get the vaccine because of potential fertility issues and even freeze their eggs or their sperm. What would you say to those medical professionals who might be telling people?
What I would say is that, what I'd say more broadly to the community is that the very best of the very best advice comes from the body referred to as the National Centre for Immunisation Research and Surveillance. I spoke personally this morning to Professor Christine McCartney, who is part of that body. She's a director at that body, and she's also part of the professional advisory group, ATAGI, to the federal government. And the advice is, as I gave it earlier, And I say to those medical professionals who may not have caught up with that advice to please catch up with that advice before you give any further advice to your patients, particularly GPs. GPs are obviously very busy people, and they may or may not have caught up with the latest advice. But at the end of the day, what I would say too is that to individuals, of course, you have to take your particular medical professional's advice, but perhaps you could just query when they give you that advice, if they do, and I haven't heard of that, but if they have, then just ask whether they have been made aware of the information that comes from that particular centre. Yeah. Sorry, I'll come back. Is that right? Yep.
Clarify the situation with Camden LGA's status, and also after the discussion today that Camden and the rest of Penrith may be considered a future LGA concern, where we are with that situation.
Yeah, look, obviously the public health team are still reviewing the circumstances and watching the numbers closely in Camden and Penrith, but the basic message to the community in those areas is look out for any symptoms and definitely get tested, please. That's the only way we can manage, and go and get vaccinated as soon as possible.
It's only for vaccinations that it's now classified LGA, none of the restrictions apply, the restrictions apply.
No, it hasn't been classified as an LGA of concern. It's simply we're watching it very closely. Danica, I'll just go to Lucy first, then come to you. Oh, Antonella, sorry. Sorry.
In terms of vaccination for teachers, we're hearing some independent Christian schools are saying that they've got 10% of their teaching staff who aren't considering getting vaccinated. What will the government do? Will they be unable to teach, or what's the process? What discussions have you had with some of those independent sectors?
Look, I have seen those reports, and what I would just say to teachers, I started my professional life as a teacher, and the one thing we all go into teaching for is because we love our kids and we want to educate them and keep them safe. So I would just say to everybody out there who is in the amazing profession of being teachers, it really is essential that you go and get vaccinated. And I know there's some challenges in particular communities who have particular views, but at the end of the day, vaccination is the way out of this. We all owe it to our broader community, to our family, to our nation to get vaccinated.
But what are the consequences if they don't?
As the Premier said yesterday, that obviously is under review at the present time. The preferred position would be that as many teachers as possible. Obviously there would be some teachers who might have medical conditions, as in any other area. All of us may have medical conditions that would preclude it, but that's by far the minority. So the majority is, the message to the majority is please go and get vaccinated. Lucy, sorry, Danica, I'll come back to you. Yep.
Just to confirm on that there, could a teacher lose their job if they don't get...
Look, it's too early. I know the media love to jump in and start looking at the bad side, if you like, of whatever aspect we say, but at this point, what we've said is clearly we want teachers to get vaccinated, and we'll review that. I think everybody in the community would like all of us to be vaccinated, because until we get vaccinated, we're not going to get out of the situation we're in. We have a very effective vaccines. Just go and get vaccinated. That's the short answer. Get vaccinated. Sorry. Second question. One more go. Yep.
Realistically, how many schools are not going to go back under the plan that we've got? The Catholic schools obviously saying it could be as many as 2/3 of schools, given we've got 8 LGAs that still have 400 cases per 100,000 people.
Look, I think that's still too early. We're still hoping that people will get vaccinated, and there will be an entirely different situation by the time of the recommencement of the school. So again, let's not jump ahead. Let's do what today demands, and today demands get vaccinated. That's what we need people to do. Danica, sorry. Yeah.
The changes that you
Yeah.
announced, are a couple allowed to get married indoors inside a venue, and also is hair and makeup allowed?
That's an interesting question. Look, the purpose is to allow people to get married, but do it sensibly. I'm sorry that we can't allow receptions or some of the really joyful other aspects, but I think we all had friends last year who, when it was down to 5 people, then went and got married, and some of them actually chose to do it then because it saved a lot of fuss. Others might want far bigger weddings. But I think that the short answer here is we can't allow that at the present time, because we've had circumstances where weddings have actually been massive super spreader events, But more importantly, just bringing large groups of people, your friends, together at the present time is dangerous. It's just dangerous. So what we've done is we've found a balance, and the balance is obviously the couple can get married with 5 people present and those who are necessary for the service, and I think that's a reasonable balance. As to makeup and hair, well, I think, Danica, you know, like all the rest of us know, whilst we all are pretty desperate actually to get a haircut, I think I've taken some large lumps out of my head trying to do it to myself. We all want it, but the reality is it's not safe to do it. But if you're living in a household or you're getting married, I'm sure that there's someone there who can help you with your makeup, Danica, if that's what you...
It's a legitimate question.
Yeah, no, I agree, but it's...
Part of the wedding day.
I agree. It is part of the wedding day, but I mean, if you're really that concerned, then you might have to defer your wedding day until another day because, no, hairdressers and makeup won't be available other than through your normal household arrangements. Sorry, can I just go... Look, it's just continuing as it has been for quite some time, particularly in the western part of Sydney and the southwestern area, although southwestern is slightly better at the moment than the western area. And it is largely still in homes and in workplaces. So it's a combination. I can't give you the precise figures today, but certainly it's in both those venues is what the public health team are advising me. Sorry, Liz, I'll come back to you. Yep.
Just a follow-up question on weddings.
Yep.
Will the guests have to be vaccinated, and will they be allowed to travel to be guests at a wedding, or do the 5 guests have to be within your own LGA?
No, they're going to have to comply with the balance of the rules. So there's no exemptions on that front. You're going to have to make sure that your wedding guests are located within the areas that are allowed to travel. No changes to that. Sorry, Liz.
Minister, given the issues on the Queensland border, do you think it makes sense to move the border south and move those checkpoints further south?
Look, there were quite a few discussions about that, and discussions continue. It's very frustrating, I must say, for residents in the northern part of New South Wales to be effectively locked out by Queensland, and it's presenting some real challenges. There are medical staff who are on this side of the border who work at the Gold Coast Hospital and vice versa, and it's certainly problematic. The issue of moving the border further, or the checkpoints further south, has been looked at, but it was considered that it wasn't viable for a number of reasons, and particularly the local community, I think, felt that having for example, the Tweed area divided in half wasn't going to be particularly successful either. So I think the answer here is not to move the border, but rather for Queensland to open up in a more free way to people who are in that Tweed area, particularly those who are needing medical attention. I can't tell you how frustrating it is for me as Health Minister to see patients on this side of the border who would normally be going across to the Gold Coast Hospital to not be able to go there. And I think reciprocally, it's really frustrating for some of the people in Queensland who would like to come across to the Tweed Hospital or have specialists on this side of the border. The border is only a line that's on maps. It's not in the community. It's something that people who live in that area don't really think about. And I would certainly ask the Queensland Government to, as soon as they can see their way clear, to consider allowing a more flexible arrangement for those in that northern area of Tweed. Having said that, I also stress I have never ever in my 20 months in this particular position ever been critical or reflective in a negative way of colleagues in other states who make decisions to keep their own community safe. That's what we do as well, so it's a matter for them, but I would ask them to reconsider that.
Sorry, just one more question. Minister.
Sorry.
While we've got
Yeah,
you, sorry.
yep.
Just in regards to weddings again,
Yep.
does everyone have to be vaccinated?
We haven't required that, but I would say to anybody who's getting married, it would be a really good idea if you asked your guests to make sure that they are double vaccinated, but it isn't going to be a requirement in the health orders, but at this stage anyway. We just want to get people back to being married. Obviously maintain your social distancing. Many of these people will be from households anyway that will be attending, so I think that each step will be taken incrementally. I think somebody wanted to ask... Yes, Lucy. For Dr McAnally. Oh, good. Yep, Dr McAnally.
Sorry, Dr. McAnally, just to confirm, as we start to vaccinate children, what sort of specialist, if any, expertise is needed for people vaccinating children? Is it different at our hubs and centres and indeed clinics? Are we going to need, or do we need specialists, sort of, geriatric or child-specific skill sets to do those jabs?
No, look, we've got a long history across our state, across the country, of vaccinating children very successfully. So the issue is about following the national recommendations, and we've got excellent protocols and procedures that are either in place or are developed to address situations of changing demographics. I might ask Susan to answer that one, if that's okay. So.
Thank you. Essentially, no. All of the staff who are working in the clinics will have the requisite training to ensure that they can vaccinate children. That's obviously part of the work that's underway now. But our well-trained, well-oiled machine will be ready when the time comes to vaccinate the kids.
Could I just say one final thing? I just want to thank all of the health staff that are working right across New South Wales at the moment, whether it's the GPs or whether it's the nurses, doctors, paramedics or the cleaners and all the people who make our health system work. This is the toughest time, I'm sure, that you will have in your entire lives in terms of working, and I just want to thank you all for the work that you're doing. And also I want to thank the media, unusually. I want to thank the media for getting the messages out and making sure the community know how important it is that we get vaccinated. All of us get vaccinated as quickly as possible. I think we're all desperate to have a Christmas more like our real Christmas, and that would be the best present of all if we could just get everybody vaccinated who can possibly be vaccinated before Christmas. And obviously that's dependent on vaccine supplies, but we're hoping we'll get adequate vaccine supplies shortly to be able to address all those issues. And finally, I'd like to thank the Auslan people who've been here day after day doing the interpreting for those who are hearing impaired, who have hearing issues. Thank you all. Thank you very much.